At night in a coastal town, it is easier to hear moans through thin walls than the sound of the sea. In the cramped houses of Salerno, adult women scratch their sheets until they bleed from contractions, menstrual pain, and prolonged inflammation that no one mentions aloud. Male doctors shyly avert their eyes. Husbands irritably repeat that it will pass on its own, and neighbors whisper about herbs, warm compresses, and strange mixtures that their grandmothers used to strengthen the uterus or stop excessive bleeding. At the same time, in the monastery scriptorium, the flickering light of the wicks falls on parchment, where words about female juices, conception, and the pain of childbirth are written in clear Latin script. The text, which would later be called Trotula, calmly and coldly describes what people on the street would normally keep quiet about and blush over. Hello to everyone listening to this analysis. Write in the comments which country and city you are from, and whether you have ever encountered the claim that in the so-called Dark Ages, no one spoke seriously about the health of adult women. I wish you a calm but attentive listening experience. Next, we will analyze not the myth that the past supposedly remained silent about the female body, but a set of very specific texts in which doctors from Salerno describe diseases, blood, discharge, and the risk of death during childbirth as dryly as other authors described fever or a broken leg. To summarize the story, in the 11th and 12th centuries in Salerno, where the first major medical school of the Latin West was formed, a collection of treatises on women's health appeared. Later, these were combined under the name Trotula of Salerno, as if we were dealing with a single author-physician. In reality, the documents stubbornly show not so much a single figure as a layer of texts. In various manuscripts, this corpus consists of 3 parts: on the diseases of women before, during, and after childbirth, on women's adornments, and on women's sufferings in a more general sense. They appear in codices separately and in various combinations, sometimes with the note Trotula said, sometimes without any indication of a name. For historians, this means one thing. What we have before us is not a romantic biography of a legendary female doctor, but a compilation collected from late antique, Arabic, and local sources by several generations of Salerno physicians. But even with this blurring of authorship, the very fact of concentration is important. In one place, under one conditional heading, descriptions of what was considered shameful and indecent to discuss in everyday life are collected. It calmly lists lower abdominal pain, menstrual disorders, difficulties in conceiving, spontaneous miscarriages, postpartum tears and inflammation, unpleasant odors that prevent women from living in the home and become a reason for social isolation. Instead of condemnation or moral commentary, the language of the 4 humors, familiar to the medicine of the time, is used: cold and warm, dry and wet, excess or deficiency of blood. Women's suffering is translated into the common medical language that was used in the treatment of men. Salerno is no coincidence here. This port in southern Italy is located at the crossroads of routes. Ships from Byzantine and Muslim lands pass through it, as does a stream of books. The medical school combines Latin remnants of the Roman tradition, translations of Greek authors, and Arabic treatises. In manuscripts adjacent to the Trotula, one can see fragments of Galen, Ibn Sina, and detailed lists of medicinal plants. Against this backdrop, interest in women's health seems a logical continuation of the general trend. Attempts to systematize everything related to the human body, even if it concerns topics that an ordinary parish priest would prefer to avoid in favor of talking about the soul. The myth that women in that era were supposedly treated only by witch doctors and that male doctors ignored their problems begins to crumble as soon as we look at specific recipes. Texts attributed to Trotula describe how to examine a patient without humiliating her, what herbs to give for excessively painful periods, how to ease contractions, and how to care for a woman after a difficult birth to prevent inflammation and blood loss. The formulas are far from modern evidence-based medicine, but there is a logic of observation in them. If the pain decreases after a certain procedure, it is repeated and recommended further. In cities where many adult women have to give birth several times and live with chronic pain, such knowledge is literally built into practice. At the same time, traces of censorship are noticeable in these same manuscripts. Copyists sometimes soften the wording, omitting overly direct descriptions of bodily processes and replacing crude words with more abstract ones. In some lists, entire paragraphs on how to distinguish one form of inflammation from another by the appearance of discharge are deleted or shortened. For some clergy, such specificity seems indecent. A grown man, especially one of the clergy, should not discuss aloud what blood looks like in a woman with a particular disease. But at the same time, these same people silently tolerate the existence of these texts on the shelves of hospital libraries, because they know that without them, the mortality rate of their parishioners would be higher. Thus, in the first centuries of the Salerno corpus's existence, a dual perspective emerged. On the one hand, there were moral norms prohibiting direct discussion of the lower part of the female body. On the other hand, there was a medical necessity that required doctors not to be shy, but to look, touch, and ask questions. Trotula, whoever she was, found herself caught between these two lines. For some, it was a suspicious text that went into too much detail about things that decent people kept quiet about. For others, it is a guide that allows an adult woman to survive another pregnancy or chronic pain and not die from complications that are so easy to develop when faced with external shame. This is where the conflict surrounding Salernitan women's medicine will continue to grow, between city doctors, accustomed to using these recipes, and church moralists, who from time to time demand that the most explicit passages be removed for propriety. But before we get to the prohibitions, we need to understand how exactly this text spread throughout European cities, and why, under the name of one mysterious Trotula, there are several voices at once, male and possibly female, trying to build a comprehensible scheme of care and treatment on someone else's sick body. The archives of Salerno and neighboring cities do not provide a luxurious biography with dates of birth and death, but they do leave several solid clues. In the city records of the 11th and 12th centuries, adult women appear from time to time, designated as medics or female doctors, who are allowed to examine female patients and charge for treatment. In one document, a widow doctor is granted the right to continue her husband's practice, while in another, a nurse is entrusted with caring for sick women in a hospital. These records are dry and emotionless, but they shatter the image of a world where only men and monastic miracles were supposed to provide medical care. In a southern Italian port, women's medical work is recognized at the city administration level, and not just as a secret women's practice. Against this backdrop, the name Trotula, when it appears in the margins of manuscripts, becomes particularly heavy. In some codices, next to the text about women's diseases, the copyist carefully adds, "This was said by Trotula, a woman from Salerno." In others, the female form of the name is replaced by the male form, Trotulus, as if someone had deliberately transformed the author into an author. Some researchers see behind this a real woman from the local nobility, connected with the medical community, while others consider Trotula a convenient mask under which an entire school legalized the discussion of things that not every male professor would dare to sign with his own name. The fact remains, the image of Trotula of Salerno helps to embody collective work in a figure that will later be debated or criticized. The texts themselves are arranged like a cold inventory of pain. In the section on menstruation, the authors list the possible malfunctions: no blood, too much blood, too dark, too light, with odor, without odor. Each option is assigned a set of causes within the framework of the then current theory of humors: excess cold, stagnation in the liver, weakness of the heart, thickness of the blood. This is followed by recipes, decoctions of certain roots, warm sitz baths, oil rubs, bloodletting in specific places. Next to them are instructions on the regimen: how much a woman should walk, how much she should lie down, what foods to avoid. This is not an intimate diary, but a production manual for the body, which can break down and take with it life, reproductive function, and the family's reputation. The sections devoted to childbirth and its aftermath seem particularly difficult. The treatise describes situations where an adult woman is broken by pain for several days, when the fetus does not come out, when bleeding does not stop after childbirth. The authors attempt to provide algorithms for action: how to change body position, how to gently stimulate contractions, what decoctions to give, how to support a woman who has no strength left. These diagrams reveal their limitations: the absence of surgery, the absence of anesthesia, the reliance on herbs and hands working in the dark with only a candle for light. But the very fact that someone attempted to systematize such situations in writing shows that this was not a taboo area, but a recognized field of professional knowledge, albeit a frightening one. At the same time, fragments are woven into the text that would later become the basis for moralistic attacks. The section on preserving beauty discusses creams, masks, skin lightening products, and ways to eliminate unpleasant body odors. By the standards of the time, this concerns not only aesthetics, but also the marriage market. A woman with a spoiled smell or noticeable signs of illness risks being rejected by her husband and community. The texts describe how to eliminate these signs without discussing what will happen to those who do not have access to herbs and expensive ointments. Later, it was these very pages that allowed moralists to declare Trotula a guide to luxury and debauchery, although for city women, they were a tool of minimal social protection. All of this is overshadowed by the prevailing view of the female body as a vessel for procreation. The treatise discusses in detail not only diseases, but also the ability to conceive, looking for signs of a cold or too hot uterus, trying to judge from external signs and the nature of menstruation whether a woman will be able to carry a child. Much attention is paid to infertility, and here the authors are particularly cautious. In a society where the absence of children is almost automatically considered the fault of women, the medical text unexpectedly acknowledges that the problem may also lie with the man. But it does so indirectly, through reservations, through cautious phrases about weakness of the seed. Even in an attempt to be objective, doctors do not go beyond the framework where the female body bears the brunt of suspicion and procedures. Nevertheless, these treatises quickly become indispensable for urban practice. Salerno trades in people and books. Handwritten copies of women's treatises are distributed along with other medical texts throughout Italy, Provence, and Germany. A doctor who received permission to practice somewhere in the north after training brings with him not only bloodletting diagrams for fever, but also tables of symptoms of female ailments. Thus, the Salernitan experience of working with adult women's bodies extends far beyond the boundaries of one city and one school. Along with this, the anxiety of those who were accustomed to considering discussions of such topics unacceptable outside the marital bedroom and the confessional grew, an anxiety that would soon spill over into demands to clean up the texts of overly explicit descriptions. It is from this moment on that the texts attributed to Trotula begin to live a double life. In university lists, as part of the general body of medical knowledge, in urban practices, as a set of techniques that can solve a specific, very physical problem of an adult woman behind the wall. The Salerno treatises were distributed along with other textbooks. They were copied in Bologna, Montpellier, and Padua. Glosses were added in the margins, and they were combined with the works of ancient physicians and Arab authors. In these mixed codices, alongside passages on the pulse and fever, there suddenly appears a section on female juices and the comfortable passage of the fetus, written in simpler, almost artisanal language. For the reader, this is a signal. This is not theory for theory's sake, but instructions for survival. A city doctor, who in the 12th or 13th century runs a small practice at home or in a shop, is confronted with a reality for which the university does not fully prepare him. Adult women are brought to him with chronic lower abdominal pain, delayed menstruation, the smell of decay after difficult childbirth, and tissue tears that are not even discussed in the confessional. Husbands often demand that their wives be fixed because a childless marriage threatens to break the contract and bring shame on the community. Relatives wait for the doctor to say whether she is to blame and whether there is hope for an heir. In this situation, the Salernitan treatise becomes something between a technical reference book and a shield. Instead of relying on superstitions or advice from neighbors, the doctor can show that he is acting according to a scheme recognized in other cities. The practical side of these texts is inconvenient for moralists precisely because it is not very concerned with propriety. The list of recipes includes not only well-known decoctions for strengthening the uterus or easing childbirth, but also more controversial remedies, which later copyists will try to describe in vague terms. Some formulas promise to promote conception, while others hint that with a certain combination of herbs and regimens, the likelihood of pregnancy decreases. In a context where marriage is legally tied to the birth of children, such knowledge can easily be declared dangerous. It gives adult women at least minimal control over what happens to them, and thus interferes with a system that views their bodies primarily as a resource for procreation. It is not surprising that it is precisely around the sections on conception and excessive fluids that clouds begin to gather. Clergy responsible for moral oversight in cities see such texts as a threat not only to chastity, but also to the very discipline of the flock. Sermons and diocesan statutes begin to include provisions prohibiting secular doctors from telling women about indecent things and undertaking unauthorized manipulations leading to infertility. The texts of the Trotula may not be named in these documents, but the descriptions match too closely. They refer to treatises discussing secret parts of the body and containing recipes that can alter the natural course of married life. In some regions, the clergy directly demanded that such books be kept only by trusted male doctors and not by midwives and female relatives. In practice, it is almost impossible to distinguish between what is permitted and what is prohibited. The same decoction that in one context helps an adult woman get through painful menstruation can in another be used to shift the cycle and reduce the likelihood of conception on certain days. The same procedure, described in a treatise as a way to ease childbirth, in the hands of a desperate patient or a selfish husband, can become an attempt to terminate a pregnancy with risk to life. City authorities and ecclesiastical courts react to the consequences. Cases appear in the records against midwives and healers accused of harming the fetus or damaging the ability to bear children. At the same time, the texts themselves, including those from Salerno, do not end up in the dock. They continue to be copied in universities as part of normal medicine. The gap between the university and grassroots perspectives is particularly evident in hospitals. In city hospitals, where adult women with severe complications after childbirth or advanced infections are treated, male doctors are forced to rely on knowledge that society considers shameful. They follow the examination procedures described in treatises, try to minimize physical contact, and sometimes work through an intermediary, a midwife or nun who examines the patient and relays the information to the doctor. Hospital statutes repeatedly emphasize the need to avoid indecency in every way, but at the same time, they stipulate the obligation to provide assistance to all who suffer. There is enough leeway between these two formulas for practitioners to use Salernitan descriptions of symptoms without formally violating the prohibitions on excessive candor. The paradox is that many clerics and moralists who condemn indecent treatises themselves depend on their results. A confessor who hears complaints from an adult woman about constant pain, bleeding, or the inability to live with her husband cannot limit himself to general words about patience. He has to decide whether to refer her to a doctor, whether to allow interventions recommended by medicine, which he himself condemns for its frankness. Some theological writings contain cautious arguments about the permissibility of treating shameful parts of the body in order to preserve life and marriage. Where the author draws on Salerno's practice, he tries not to mention names, but repeats the key idea. Caring for the health of the body, even the most intimate parts, can be a duty rather than a sin. Over time, it is clear from the manuscripts that the pressure is increasing. In some lists, entire passages about pleasures and desire are neatly cut out with a knife. In others, words describing arousal and release are replaced with more general euphemisms, and next to them, the copyist notes that such things should be omitted when reading aloud. This is how the censored version of Trotula came about. The core observations about diseases, bodily fluids, and childbirth were preserved, while anything that could be interpreted as encouraging excessive attention to the body was removed. But even in their truncated form, these texts continue to bring to the doctor's table the very information that the myth of the silent Middle Ages refuses to acknowledge: detailed, systematic knowledge of adult female physiology. In the university environment, the Salernitan treatises gradually lose their personal character. Trotula's name appears, then disappears, then turns into a masculine form, until some professors begin to quote these texts without indicating authorship, as an anonymous tradition. In medical lectures, they were linked to Galen, Ibn Sina, and other authorities, putting them on the same level. The section on the uterus and menstruation became as normal a topic of discussion as the section on the liver or lungs. This did not abolish social taboos, but it created a different axis. Within the body of knowledge, the female body was included in the general plan of human anatomy and pathology, rather than being relegated to the realm of indecent silence. It is this dual existence, under the pressure of censorship, and at the same time at the center of the curriculum, that makes the history of the Trotula one of the most striking contradictions between legend and document. Clergymen who view all this from the outside need only read a few pages of the female treatise to feel alarmed. For a person raised on hagiographies and canon law, Latin phrases about abundant discharge, foul-smelling juices, pain during intercourse, and tissue tears during childbirth sound not like professional language, but like a violation of decency. In the instructions for the clergy, vague warnings begin to appear. There are books that describe too much detail about things that are better left unsaid. There is knowledge that is useful for doctors, but dangerous for lay people. The titles of the treatises are often not spoken aloud, but it is clear from the wording that it is the texts of the Salerno circle that are being targeted, where female physiology is discussed bluntly, as a normal part of medical practice. In city affairs, this tension manifests itself in small things. In the minutes of a midwife's interrogation, alongside accusations of working without a guild license, a line about suspicious books found in a chest may suddenly appear. In the monastery archives, among the papers on violations of the charter, there is a record that a nun was found in possession of a medical treatise on female ailments that was not approved by the abbot. The wording is vague. Inappropriate reading, knowledge, dangerous to simple minds. Punishments are usually limited to a reprimand, a fine, or confiscation of the manuscript. But the very fact that the book is the subject of an investigation shows that the problem is not the care of the sick itself, but the control over the words used to describe that care. At the same time, the same church infrastructure that raises the question of propriety relies on these texts in practice every day. In hospital houses attached to cathedrals, in shelters for pilgrims, and in women's monasteries, nuns and hired doctors encounter the same bleeding, lochia retention, and purulent inflammations that Trotula writes about. Modest notes appear in the margins of the manuscripts: reduce the dose, replace rare herbs with local ones, heat the decoction more in winter. Someone adds a prayer formula or an instruction to call a priest before starting a dangerous procedure. Thus, the medical text becomes overgrown with a layer of pastoral remarks, but continues to live and work, even if the sermon nearby condemns shameless talk about juices and carnal organs. In university programs, women's medicine occupies an intermediate position. Masters readily recognize the Salerno school as an important link in the transmission of ancient heritage, citing it in lectures on humors and fevers, but special chapters on the uterus, infertility, and postpartum trauma are often relegated to more specialized courses or left for independent reading. In an audience of future court physicians and city doctors, it is still customary to avoid overly specific descriptions of the lower parts of the body, but the same students take notes in their notebooks on recipes for compresses, suppositories, and baths suggested by Salerno authors. This results in a double standard. Official rhetoric pretends that shameful topics are peripheral to medicine, while practical medicine turns them into an essential part of the craft. At the intersection of these layers, the future conflict of the print era is born. As long as manuscripts remain rare, they are tolerated as an internal matter of the profession. What is discussed in a closed group does not have to be visible to the world. But as soon as texts dating back to Trotula begin to be printed in large numbers, the question of who has the right to read about female juices and conception will go beyond the confines of the monastery library. By this point, Salerno's women's medicine has managed to accomplish its main task: to establish in professional norms the idea that the body of an adult woman, with all its blood, pain, smell, and risks, is not taboo, but an object of special knowledge. Only later would new walls of censorship and propriety begin to be built around this knowledge, but the foundation had already been laid in the form of Latin pages, where female suffering was called by its proper name. By the time the manuscript tradition of Salerno texts approached the threshold of the printing era, a characteristic buzz had already formed around the name of Trotula or Trotula. In university lists, her treatises appear in the same volume as the classics. In hospital inventories, they are listed as practical guides, and in theological records, there are occasional dissatisfied remarks about overly bold descriptions of the female body. The advent of the printing press changed the scale of both the threat and the opportunities. What had previously been read by a few could now be reproduced in hundreds of copies. For city doctors, this was a chance to gain access to systematic experience with women's diseases. For those clergymen who were accustomed to viewing the female body through the prism of shame, it was a risk. Shameful topics went beyond the confines of narrow corridors and fell into the hands of people whom they considered insufficiently prepared to discuss such things. The first printed collections to include texts from the Salerno school present them as part of the general body of medicine, not as a separate female scandal. One volume contains treatises on kidney stones, fevers, and ulcers, alongside sections on menstrual disorders, painful childbirth, inflammation, and infertility. For the printer, all this is primarily a commodity and a matter of reputation. The publications are aimed at university students and practicing doctors. and the famous name of Salerno increases the value of the book. In the prefaces, the editors sometimes cautiously explain that issues of childbearing and juices are discussed for the sake of health, not curiosity. This is a kind of insurance, a demonstration of loyalty to moral expectations, while actually publishing detailed descriptions of female physiology. At the same time, concern is growing in theological and legal circles about how secular doctors are using this knowledge. Cases against women accused of witchcraft or illegal interference in birth and conception appear in the records of some city and church courts. A careful analysis shows that some of the charges are related to attempts to regulate the cycle, ease labor pains, and interfere with pregnancy. The charges are vague. They refer to abuse of herbs, secret potions, and bloody deeds. What remains in the shadows is the fact that the recipes themselves are often taken from the same Salerno treatises or their derivatives. The only difference is in status. When a university doctor reads a Latin text, it is science. When an illiterate midwife in a poor neighborhood uses similar practices, it is easier to call it witchcraft. Against this backdrop, the first direct attempts to limit the spread of women's sections appear. Church censors, reviewing manuscripts and printed sheets for approval, sometimes demand that the wording be softened, that overly explicit descriptions of sexual organs be removed, and that instructions that could be read as advice on consciously avoiding conception be deleted. In a number of late medieval publications, traces of these interventions are indeed visible. Phrases broken off mid-word, pieces of text replaced by general remarks about proper moderation, and the absence of some of the most delicate recipes. At the same time, the main structure of the treatise remains intact. The doctor still receives a framework for assessing the nature of discharge, the location of pain, and dangerous signs during pregnancy or childbirth. Censorship trims the edges, but does not destroy the core of the experience. At the same time, the figure of Trotula herself changes in the reader's perception. In some manuscripts and editions, she is presented as a specific female doctor from Salerno, whose name has become a symbol of competence in women's health issues. In others, the name begins to be perceived as a conventional designation of the genre, a book on women's diseases, regardless of who actually wrote its parts. Over time, the Latin form of the name becomes even more detached from the living person and turns into almost a label. This has a double effect. On the one hand, women's contributions to medicine dissolve into an impersonal tradition. Instead of the real Trotula, reconstructed from rare references, later readers see a generalized Trotula, sometimes even considered a man. On the other hand, the very fact that an authoritative text on the female body circulates under this name shows that systematic female medicine is enshrined in the canon, even if the author's identity has been blurred. In the mass of popular literature about the past, the myth will long persist that the so-called Dark Ages preferred to remain silent about the body in general and the female body in particular. Against the backdrop of modern ideas about taboos, this seems logical. Strict morals, the church, prohibitions. But a comparison of paper traces breaks this picture. In monastery libraries and city archives, dozens of manuscripts are found that discuss in detail symptoms related to the uterus, ovaries, breasts, and genitals, as well as pain, discharge, difficult childbirth, and complicated postpartum conditions. These texts are not hidden away in separate, secret cabinets for the select few, but are included in ordinary medical compendiums. Yes, there is controversy surrounding them, and yes, some of the wording has been toned down, but the very existence of an extensive body of women's medicine contradicts the convenient modern legend of total silence. It is also important to note how long practical recipes, born at the intersection of book medicine and everyday experience, have survived. Even when the spiritual authorities oppose excessive candor, Doctors themselves continue to write their comments in the margins, noting which remedies helped a particular patient, for which symptoms it is better to use warm baths, and for which, bloodletting, in which cases herbal infusions allow one to disperse stagnation and prevent fatal inflammation. City inventories of doctors' property sometimes list not only books, but also instruments, fragrant ointments, and stocks of dried plants. Behind each such list is a silent row of bodies from which pain was relieved and on which recipes were tested when there was no choice between shame and life. At the turn of the late Middle Ages and early modern times, the figure of Trotula of Salerno becomes both disturbing and familiar to the educated reader. On the one hand, it is a reminder that somewhere in the south, in a city by the sea, there was a school that was willing to talk about the female body without turning every detail into a moral judgment. On the other hand, it is an example of how any body of knowledge relating to shameful topics constantly balances between usefulness and the threat to reputation. Manuscripts with recipes for new mothers and infertile patients saved lives and reduced the number of painful and pointless interventions, but at the same time became the object of suspicion. What if someone used this knowledge incorrectly to interfere with the order that theologians considered to be ordained by God? The final paradox of this story is that in the long run, it is paper that wins out, not the whisperings of propriety. Texts from the Salerno tradition, reworked, rewritten, and in some places censored, continued to be included in medical compendiums until the era of university reforms. They normalized the very idea that the female body was not an exception to the general system of medicine, but rather a part of it that required its own categories and experience. The myth that the past was silent about the female body turns out to be a convenient but inaccurate reconstruction. The document shows something else: uneven, contradictory, sometimes cruel, but still systematic work on the description and treatment of female diseases. The outcome depends not on abstract forces, but on concrete decisions. An unknown clerk who did not delete the section on infertility from the manuscript. A city doctor who risked using a suspicious remedy for the sake of his patient's life. A copyist who carefully transcribes the text attributed to Trotta into a new codex. A publisher who inserts female chapters into a general volume on medicine. All of them, step by step, ensure that Salerno's female medicine does not disappear under a layer of shame. This is its grim legacy, not in the romantic image of a female doctor against the backdrop of the sea, but in the fact that amid pain, blood, fear, and censorship, there was still room for dry lines about how to ease contractions, stop inflammation, and restore the cycle when the body suffers. Between the myth of silence and the real practice of survival, it is the very boring text with lists of herbs and symptoms, which has been rewritten for centuries on cracked parchment, that wins out, because without it, too many adult women would simply not live to see the next holiday in their city.